So why is there a need to care for patients on both the seen and unseen environments? Patient. The word is straightforward. When you review its meaning, it is someone who is waiting for care or receiving it. The U.S. Center of Medicare and Medicaid Services define it as an individual who is receiving needed professional service that are directed by a licensed practitioner of the healing arts towards maintenance, improvement, or protection of health or lessening of illness, disability, or pain. While it is apparent that a patient may need care from us, we must remember that a patient's seen and unseen environment both play a pivotal role in making sure we don't just focus on one aspect of the patient's life. The message of 2 Corinthians 4:18, so we fix our eyes not on what is seen, but what is unseen, since what is seen is temporary, but what is unseen is eternal. In terms of how this is relevant to us as future providers, we must acknowledge that just because we can treat those does not always mean we should. For example, Farr's nursing theory focuses on the patient's perception of care without judgment, and that the patient's quality of life is what the patient decides is appropriate. Um, Johnson, Cohese, and Greginski mentioned that a person's unseen environment is different for each, as it is every individual's own experience and interpretation. They further mentioned that an unseen environment can affect not only the patient but also communities, societies, and culture. As future providers, we must realize that while it may be easy to focus on the seen environment, that it will be harder to connect to a patient's unseen environment if we do not maintain open-mindedness. Gene Watson's theory of human caring is an excellent example of how providers can use this theory to seek deepening understanding of the universal, ethical, and person-centered roots of caring and healing for self. Foss, Durant, McDermott, Kenny, and Triner used their theory as a framework, and they found that their providers became re-engaged in the purpose of their work. With healthcare being an industry-wide movement, we must remind ourselves of health that is well-being and wholeness of both a unseen and seen environment.